Hello everyone, my name is Shahnaz and I welcome you all to my channel Nurses, the Heart of Healthcare. Think outside the box. Keep learning, keep growing. As we all know friends that nursing education is not a one and done phenomena. Nurses can never be shaky or rusty on their knowledge. A good professional nurse need to have sound knowledge, nursing skills, experience and use their critical thinking skills to make effective decisions which improves patient quality of care, patient safety, patients improves better outcome of the patient and improves the workflow. And not only this, it can create an environment that cultivates innovation. Okay, and to do or to be a part of this effective decision making process, nurses should have sound knowledge. They should be a lifelong learner. Nurses are the one who initially assess and reassess their patient. Nurses are the one who communicate with the patient and their families, and they are the ones who can identify the patient healthcare requirements, and not only just identifying, they can also adjust the treatment accordingly. They are empowered to do so. Okay, so the main theme of this video is to create an awareness among all the nursing professionals regarding nursing empowerments. We are not going to discuss what is the definition and the factors and all that. No, we are going to discuss some of the decision making powers that nurses have, which can improve the quality of patient care and which can improve the better patient outcome and workflow, and we can save life. Okay, many a times we come across situation wherein we find the patient in critical condition and we feel powerless. We feel that we don't have the authority, we don't have the license to take so and so action. But no more, we have some decision making powers which can save patient's life, but we should be aware of it and we should have sound knowledge and critical thinking skills to make effective decision and take right action at right time to save patient life. Okay, so in this video we are going to discuss some of the decision making powers that nurses have which can save patient life. So whenever we find the patient in some of the critical condition, instead of running around to inform it to the doctor and take the orders, we can take action immediately to save the patient life and to prevent the patient condition from worsening. Okay, and then we can inform the doctor and later on we can obtain their concern and order whatever it is. Okay, so let's discuss some of the nursing empowerments. Okay, so in this video we are going to discuss about 10 nursing empowerments, 10 decision making powers that nurses have. Not more, we have many, but we are going to discuss only 10 of them here because it will become lengthy otherwise. Okay, and before moving ahead, I would really appreciate if you are new to my channel, please subscribe my channel, and if you find the content helpful, please like and share my videos. Okay, the first nursing empowerment, the first decision making power that every nurse has is nurses are empowered to do nursing assessment. Okay, assessment and reassessment too. So whenever we receive a patient in emergency department or in an ICU or ward or pre-op, wherever you are posted in the hospital setting, whenever you receive a patient, you have the power, you have the right to perform the nursing assessment. Okay, you can check the vitals, you can check the GCS, and whenever required you can reassess the patient too, so that you can identify the changes in the patient's health. Okay, and then plan your nursing care accordingly. For performing the nursing assessment, you don't require doctor's order or doctor's permission. You are empowered to do so. No one will question you that why you have assessed the patient without my permission. Okay, so this is the first nursing empowerment. Okay, that they can perform the initial patient assessment without doctor's order. Okay, then next one. Okay, the second nursing empowerment that we are going to discuss is nurses are empowered to do cold sponging in case of hyperpyrexia and high grade fever. Okay, so when you're doing your assessment, patient assessment, and you find that your patient is having high grade fever or hyperpyrexia, which is a medical emergency, you are authorized to perform cold sponging to bring down the patient's body temperature, and you don't require to take doctor's order for it initially. Later on, you can inform the doctor that my patient was having this much temperature and I did the cold sponging and followed by cold sponging. This is the temperature now. Okay, so this is a decision making power that nurse have, because we know that hypothermia is when the patient is having temperature more than 100, but hyperpyrexia is when the patient is having temperature more than 105 degree and it is a medical emergency. Hyperpyrexia requires immediate medical treatment. When the patient's body temperature increases too high for a long period of time, it can result in brain damage, it can result in coma, it can result in death. Though the hypothalamus tries its level best to effectively manage, but still, okay, because in hyperpyrexia many of our body organs including our brain, heart, gut, liver, kidneys, they fail to function properly. Okay, so whenever the patient is having high temperature, immediately we can start cold sponging. Obviously we will be giving them paracetamol. Okay, if adults, in case of adults, we give 1 gram PCM, and if they are kids, according to their body weight and age, we'll give them paracetamol. But there are some patients, like for example chronic liver disease patients, we cannot give them paracetamol, then we have to go for cold sponging. Okay, so even if paracetamol is given, it will take time, so we have to do cold sponging. So this is one of the decision making power that lies with the nurse, okay, which they can take it in time to prevent the patient condition from worsening. Okay, the third decision making power that nurses have is nurses are empowered to administer 25% dextrose timely to manage acute hypoglycemia. Okay, so when we are assessing the patient, when we check their GRBS, we found that it is low. Okay, then especially if it is less than 40 mg per dl, okay, it is severe hypoglycemia and it is a life threatening condition. So we don't have to run around to escalate it to the doctor and get their orders and then take the action. No, the nurse have the power to get an IV access. If the patient is already have an IV access which is working, it is well and good. Otherwise, obtain an IV access and then immediately start 25% dextrose. And then later on you can inform the doctor and recheck the blood sugar and then follow their orders. Okay, because as we all know that brain is a very important as well as delicate and sensitive organ. Okay, and the main fuel of the brain is glucose. Okay, so if we starve the brain of glucose, then it may lead to seizures, coma, or even death. Okay, so hypoglycemia is a medical emergency, and if it is not treated, it can cause, it can lead to life threatening conditions. So that's the reason whenever we find that the patient blood sugar levels are low, see, less than 70, the patient will have altered mental status, headache, anxiety, nausea, vomiting, fatigue, sweating and all that. Okay, so when you find the patient is having blood glucose level low, then immediately get an IV access, start 25D, and then you can inform the doctor, recheck the blood sugar whether it has improved or not, and follow their orders. Okay, so instead of running around and wasting time, immediately we can take an action to prevent the patient condition from worsening. Okay, the fourth nursing decision making power is nurses are empowered to initiate CPR and activate code blue. Okay, so when you find a patient unresponsive, okay, when you are visiting the patient, you find the patient unresponsive, immediately the nurses have the power to activate code blue and initiate CPR. They don't have to wait for the doctor's order, because following a cardiac arrest, okay, delay in CPR after cardiac arrest can result in poor patient outcome. With every minute delay in CPR, in initiating the CPR after cardiac arrest, there will be 10% decrease in survival rate. Okay, so every minute you delay, 10% survival chances decreases. By 9 minutes of delay, there will be severe and permanent brain damage, and after 10 minutes the chances of survival are very less. Okay, so that's the reason there is no point in running around and informing the doctor and then getting the orders. No, whenever you find any patient unresponsive, immediately you can activate code blue Then check the patient pulse and respiration using look, listen and feel technique. And then if you find that there is no pulse, there is no respiration, immediately initiate CPR. Follow the BLS protocol, and then till the emergency team arrives, or if you are already in emergency, then you will have the crash card and everything available over there. You can follow the ACLS protocol too. Okay. And if you find that the patient is unresponsive but the patient pulse and respiration is present, then check the GRBS. Okay, and monitor the patient till you get the help. Okay, and if you find that the patient is unresponsive, pulse is present but the patient is not breathing properly, then you have to manage the patient's airway. Okay, you have to look for if the patient requires suctioning, or the patient need to you need to put an oropharyngeal airway or what. Okay, so you have to manage the patient's airway. This is what you can do. Okay, so nurses are empowered to initiate CPR and activate code blue, because it can save life. Every minute counts. When there are some medical conditions or there are some medical emergencies where every second, every minute counts. Okay, delay in the treatment can lead to a permanent damage to the patient, or it can decrease the survival chances. So that's the reason, use your critical thinking skills, make effective decision and take an action immediately instead of running around and wasting time. The next decision making power that nurses have are, nurses are empowered to stop the drug on flow in case of any adverse drug reaction, and then they can inform the doctor. Okay, so I think we all know very well about the drug hypersensitivity, which is nothing but the adverse drug reaction, because medicines that we are giving to the patients are nothing but chemicals. Okay, if they have some effect, they too have some side effects, as well as some patients may develop, if they are allergic to, or if it is not suitable for them, they may develop some allergic drug reaction. Okay, for example, you are administering a medicine to the patient, and if the patient develops hives, watery eyes, sneezing, rashes, itching, tender bumps, blisters, okay, or if the patient is having vomiting or swelling or redness, diarrhea, or swelling of the tongue, or cough, or chest tightness, or stomach pain, or trouble breathing, or there is runny nose. Okay, if you find any of these symptoms following an administration of a medicine, then nurses do have the right to immediately stop the medicine on flow. Okay, and then they can immediately escalate the matter to the doctor, and as per the orders, we can give them antihistamines. If it is mild drug reaction, we can give them corticosteroids to decrease the inflammation, and if it is a severe anaphylactic shock, we can administer epinephrine too, adrenaline. Okay, so antihistamines are given, like Avil injection, Avil is given if it's a mild drug reaction. Okay, which can be diluted in 10 cc normal saline and can be given direct IV, slow IV. Okay, and corticosteroids can be given like hydrocortisone 100 mg or 200 mg as per the doctor's order. Okay, to decrease the inflammation. And if it's a severe anaphylactic shock, then we can administer adrenaline. Adrenaline sometimes can be given IM too. Okay, so this is nursing empowerment. Okay, so whenever you find a patient is developing an adverse drug reaction following an administration of a medicine, then you do have the right to immediately stop the medicine on flow and disconnect it. Okay, and then you can inform the doctor. You don't have to run around to inform the doctor to stop the medicine. Okay, so this is one of the nursing empowerment. Okay, the next nursing empowerment that we are going to discuss is, nurses do have the power, nurses are empowered to start oxygen administration in case if the SpO2 is less than 85%. As we all know that the normal SpO2 is 95 to 100%, and there are some conditions like in case of myocardial infarction or COPD patients or severe trauma, or if there is severe respiratory distress where you find that the patient SpO2 is going below 85%, then nurses do have the right, do have the authorization to start with the oxygen administration immediately, and then later on they can inform the doctor to get the written orders. Okay, but for this you should have the sound knowledge of all the oxygen flow devices. Okay, we have low flow oxygen devices and high flow oxygen devices, so we should have a sound knowledge of which oxygen device to be used, okay, and with what flow and how much FiO2 it can deliver. Okay, so if we have the sound knowledge regarding it, for surely we can make an effective decision to start the right oxygen flow device with the right FiO2, so that we can prevent the patient condition from worsening. Okay, so this is again a nursing empowerment. Okay, the next nursing empowerment is nurses are empowered to apply physical restraints to the patient who is trying to harm himself or herself or the other staff members. Okay, and later on they can obtain the order of a doctor. Okay, so when you find that your patient is agitated, not cooperating in the treatment or interfering with the treatment, okay, and making the procedure difficult, then nurses do have the right to apply physical restraint. I'm talking about the physical restraints here, because there are chemical restraints too. For that you need to have a doctor's order, but here I'm talking about the physical restraints. Okay, that is ankle pads and arm pads that we can apply to the patient to immobilize their upper limbs and lower limbs, so that we can facilitate the procedure. Okay, and for this you don't have to wait for the doctor's order. Whenever you find that the patient is not cooperating or trying to harm himself or herself or trying to harm the other staff members, then immediately you can restrain the patient. Okay, so one can control the patient and the other can help to get the restraints from the stock or the pharmacy, wherever it is available, and then apply the restraints, and then later on you can take the consent from the doctor as well as from the family members. Okay, because to apply the restraint we need to have the family's consent, which will be valid for 24 hours. Okay, and then later on you can document what has happened and why the restraints have been applied, and the consent also you can keep in the file. And please remember, physical restraints are just to immobilize the patient safely. Okay, to limit only their movements, and this physical restraint should not cause any soft tissue or any muscle injury or any bone injury or any joint injury. Okay, so this is only to restrict the patient's movement, to immobilize the patient safely. Okay, so this is one more nursing empowerment, that you can immobilize the patient by applying physical restraint whenever they are trying to harm self or others. The next nursing empowerment is nurses are empowered to refuse to administer a medicine if order is not written in the drug chart, except in case of verbal order and emergencies. Okay, except in case of emergencies, please let me make it clear. In case of emergencies, like for example the patient CPR is going on or intubation is going on, or the patient is agitated or having seizures, okay, in such medical emergencies, okay, that time later on you can take the written order, but first you have to administer the medication to save the patient's life. But apart from that, nurses do have the right to refuse to administer the medicines if the order is not returned, because later on they can deny that they have given the order, or they may forget. Okay, so that's the reason whatever care we are giving, documentation is also important. Simultaneously we have to document. We should have what we say, a written proof that so and so care has been given, so and so medicine has been given. So nurses do have the right to refuse to administer the medication if the doctor is not writing the written order. Okay, so first get a written order from them, and then check the medicine, follow all the rights of drug administration, and then administer the drug to the medicine, except in case of emergency, like you are giving a CPR or intubation, or the patient is having seizure, etc., etc. Okay, so except in case of emergency, we have the right to ask for the written order. Okay, the next nursing empowerment is nurses are empowered to give steam inhalation and to do suctioning in case of patients suffering with throat and chest congestion. Okay, may it be oropharyngeal suctioning or endotracheal tube suctioning or tracheostomy suctioning, whatever is the kind of airway, if you have advanced adjuncts or the basic adjuncts. Okay, so whenever you find that there are secretion, you hear the sound, and the patient is having chest congestion or throat congestion, we can perform suctioning. For that we don't have to wait for the doctor's order, we don't require doctor's order for that. Okay, and later on you can inform the doctor. Okay, and whenever the patient is having chest congestion or if there is any throat congestion, we can give steam inhalation to the patient. We all know very well that steam inhalation is better than nebulization. Actually, it is more effective than nebulization when it is given properly. Okay, so whenever the patient is having chest congestion or throat congestion, we can give steam inhalation to the patient, and if the patient requires suctioning, may it be oropharyngeal or through endotracheal tube or through tracheostomy, we can perform suctioning by following all the guidelines properly. Okay, by following all the aseptic techniques, we can do the suctioning so that we can prevent the patient condition from worsening and prevent complications. Okay, the last nursing empowerment that we are going to discuss in this video is nurses are empowered to change the wound dressing performed by the nursing staff in case of wet or soil dressing, and collect the swab if pus is observed, and then inform the doctor. Okay, so whenever we have done the dressing to the patient and we find that the dressing is wet, okay, the dressing is wet and it looks contaminated, it is soiled, then we do have the right to change the patient dressing. Okay, by following all the aseptic technique. And during the dressing, if you found there is pus there, okay, that which is a sign of infection, then we can collect a swab and then inform to the doctor so that they can prescribe whatever the antibiotics required for the patient. Okay, we can send that swab for the culture and sensitivity, and till the report is obtained, it takes time for the culture and sensitivity report, so that till that time they can administer some broad spectrum antibiotic for the patient. Okay, so these are some of the decision making powers that nurses have, okay, that they can make use of to improve patient quality care as well as to save the life. Okay, and to prevent the patient's condition from worsening. Okay, so nurses, be aware, empower yourself with sound knowledge, nursing skills, and what we say, critical thinking skills, and using all this, please make effective decisions so that we can be a lead and a partner in the transformation of healthcare industry. Okay, so empower yourself and use these decision making powers to save life and to prevent the patient condition from worsening. Thanks for watching, and if you find the content helpful, please like and share my videos and subscribe the channel. So stay connected with Nurses, the Heart of Healthcare. Be a lifelong learner. Keep learning, keep growing. Thank you.